My name is Dennis Ford, and I'm the founder and CEO of Life Science Nation, and also the guy that invented this Resi conference. And so the Resi conference is really interesting because I was down in Barcelona at a investor conference, and there were no investors at this investor conference. I'm like, wow, I just flew all the way to Spain. And then like 6 months later, I'm in Dublin, Ireland at an investor conference, and there's like no investors there. And so I said, I can't believe I do all this stuff and I can never get, I can never actually get investors at an investor conference. So today we have like 300 actual investors at our investor conference. And the reason we're able to do that is because we have a database that we've been curating for 5 years now. So we have 7 or 8 research staff, and typically they come out of a lab or they come out of a PhD program or some kind of science program. They come in and they say, I don't want to be on the bench, I want to go do business. And so we say, okay, if you want to do business, you got to learn how to like get on the phone. So we put them on the phone and we just have them call investors. So we have a list of investors, and everybody's saying, you can't call investors with people who don't know anything about investing and they just got out of college and they don't have anything. No, the investors will refuse to speak to them. And what we did is we said, okay, well, here's a little survey. Call an investor up and say, hey, I'm just joined this company. I don't know anything about business, but I want to ask you some questions about your investment mandates. And the investor said, oh, you don't want to sell me something? You're not asking me for something? You just want to talk to me and you just want to get some information from me? I'd be happy to help you out. And so we started by doing that, and we started curating this database. And so we realized that in the investor space, there are 10 categories of investors. So when people go out and raise money, they typically say, oh, I'm going to go find a VC. Well, you can't go find a VC because if you're early stage, going to a VC is an oxymoron. They're not really into investing in the early stage space. And so what we did is we said, who really invests in the early stage space? Who are the guys who care? And so it turns out, foundations are really big in the early stage space because they're looking for bleeding edge technology that they can help along with their global network of KOLs. There's family offices who have somebody in their family that might have a disease that they want to help, and they have money, so they put that money in. There's pharma companies that have worried about their early stage pipeline, and there's they have to go find a lot of technology. So there'll be like 15 scouts all over the world looking for technology in all the pockets of technology that are out there. So yes, it's San Francisco, yes, it's Boston, yes, it's Toronto, yes, it's Houston and everybody else in Minneapolis, but it's also up in Halifax, Canada, and it's also outside of Houston, and it's also down in San Diego. So it's really hard to figure out where all of the early stage investors are, but we've managed to put them inside of 10 categories. So of course there's a handful of VCs that actually know how to invest in the early stage space. And we know all of them, the ones in Sand Hill Road and Palo Alto and all the guys out over in Cambridge. So we have this database. So when I was at these conferences, I said, you know what, I can just call the people I know in my database, and if we do it right, here's what we can do. We can create 16 panels. We'll have a family office panel for medtech. We'll have a family office panel for drugs. We'll get all of the people together. If we get 5 investors per panel, we'll have 80 investors, and that's like 80 more investors than I've ever seen at a conference that I pay money to go to that never have any investors. There's a lot of guys there who want to do debt financing. There's a lot of guys there who will go raise money for you and ask for a stipend, but there's never any investors. So today in that room, there's 300 investors with about $3 billion in mandates that we have interviewed them for, and they have told us they've got the money and they want to spend it, and they're looking for early stage partners. So, so that's the database that we have. of investors. And then we also keep a database of 46,000 early stage companies. So as a consequence, we sell that database to all the CROs and all of the folks that are service providers. And as a result, we know all the scouts from pharma, we know all the CRO guys, we know all the CMO folks, because we're selling them this database of 46,000 profiles. So the profiles that we have are really accurate, and that has created kind of like this buyer-seller ecosystem, and we put ourselves right in the middle of it. So we know all of the investors for early stage, we know all of the early stage global companies, and so we have this global network that we're now able to use. And so we started out with the Resi conference in Boston, and then we went to JP Morgan, and then we went to Toronto, and then we went to Texas, and we went to San Diego with Bio. So we're kind of moving this conference around with all of the people we know, and we've kind of created this ecosystem, and we call it like the tribe of people, both buyers and sellers, fundraising CEOs and global early stage investors that come to the Resi conference. They meet and they do business. Like I just saw a guy today, who told me, oh yeah, at the San Diego conference, I wrote a check for $100,000 to one of your early stage companies. I said, that's great. And then I saw another fundraising CEO today, and he told me at the Toronto conference, I met a guy, and he just, I'm going to get $2 million. And so we did a quick poll about a month ago, and we found that 62, and now it's 64, companies have gone to Resi, and they've raised about $120 million. So coming to Resi, meeting investors actually really works. So that's the good news. We also have an investment bank, which we call Boston Innovation Capital. And Boston Innovation Capital will help you raise money, and will do $10 to $50 million fundraise. So we've currently done our first flight. We've been around for 18 months. We did our first 5 and got them through, and now we're doing our second 5 companies. And we're learning a lot firsthand about what it takes to raise money, and we have really sophisticated people that we work with, great technology, CEOs who have been there, done that. They've merged, acquired, IPO. They really know what they're doing. And so when they come into my broker-dealer, we're getting great technology with great management teams and super expertise, and we have our database, and we know everybody, so we can get these guys 40, 50, 60 meetings in a 3 or 4 month time frame, but it's still really hard to get funded, even when you've got great CEO, great technology, and we put all these people together with people who said, yes, I want to invest in this type of product. It's really hard to get funded. So, what have we learned? It's a numbers game. The more had a meeting yesterday with the folks that came up from Chile, and Rick Berenson, one of our angel investors, said, you got to kiss a lot of frogs before you get a prince, and it's just a pure numbers game. So you got to go for it. So this is some of the things that we'll talk about today in our presentation. So if you're actively raising capital, we've already did that. The question is, do you know how long it takes? And for the sake of it, I'll tell you, a lot of people wish it would take 6 to 9 months, but it actually takes 9 months to 18 months. And we're working with 10 customers total in the last 18 months that are great, and they're all going through the pipeline. Like, they meet the guy, they have the thing, they do the due diligence, they get into the term sheets, and it just never, ever goes fast. So you've always got to have this plan B that, if you think you can do it in 6 to 9 months, it's not, if it happens, it does happen, good for you. And if it doesn't happen, you got to plan for a year, and if it's not that, you got to plan for a year and a half. So, how much does it cost? Well, I want to figure it out. And it's you've got to create your branding and messaging, which we'll talk a little bit about today. You've got to do your collateral. You've got to go to conferences. You've got to go on some road trips to meet the investors. You've got to get a global target list of investors that are a fit for your stage of development and your product set. And when you do all this stuff, it's 70 to 100 grand. And so if you're trying to raise money and you don't understand the fact that you got to spend money to raise money, you got to jump on the plane and go to the Resi conference at Bio, and you got to go to the Resi conference up in Toronto, and you got to go to the one in JP Morgan. If you don't do that, then you're stuck in what we call in this regional mode. And so when you're in a regional mode, it basically starts to defy the statistics of how you raise money, because raising money is 100% a numbers game. And when you're raising money, you're basically now in this whole world of selling. And when you get into the world of selling, you're not a scientist anymore. You're a salesperson, so you got to start playing the sales game. And so what happens a lot is nobody wants to play the game because they're scientists, and they say, hey, I want to play my scientist game in raising money, and then they wind up failing because it doesn't work that way. So it's a pure numbers game. If you have X amount of investors that are fit for your stage of development in your product set in New England, and there's 500 of them and 50 are in New England, the other 450 you're not going after. So that's where the statistics really gets you. I can tell you a story about a guy that we did a video for that he came to me and he said, you know, I'm going regional, I got all these friends in New York, I'm going to do all this between New York and Boston, I'm going to raise my money, and that's what I'm going to do. And I said, you know, you're crazy, you need to go global, and you need to, you know, go to these national and international conferences. And so he comes back 6 months later and he said, so I spent all my money and nothing happened, and I got ripped off in New York City with these guys who were supposed to do a video for me, and they didn't do it, so they took my money, and now I'm broke, and now I can't do anything. And so, so I said, you know, did you get the storybook, the storyboard? And he said, yes. I said, give me the storyboard. So I took the storyboard and I gave it to my graphics people, my animators and my graphic designers. I said, take the storyboard and see if we can just put something together for this guy, 3-minute video. So we came in on the Sunday. We delivered it on, we delivered it on Monday, got him in, fixed it up. On Wednesday it was done. We did a list of, it was for people who, he has a product that if you take a drop of newborn baby's blood, it'll test it for 265 rare diseases. So we went into our database and we said, okay, how many people are looking for a genetic pediatric diagnostic products? We got like 120. We just wrote this little email saying, here's this video that shows this new product that can, with a drop of baby's blood, newborn baby's blood, tested for 265 rare diseases. And at the same time as this thing's winging across the internet, this guy in Hong Kong just exited Groupon, and he had a bunch of money, and he said, I want to go invest in pediatric diagnostic genetic testing. And this thing comes in his email, he opens it up, it's this 3-minute video of exactly what to invest in. He calls the guy up, and 6 weeks later, they got an investment. So, you know, there's a luck factor, and then there's a fact of life factor. And, you know, you can get lucky, and I'd rather be lucky than good any day of the week. But if it's not going to, luck isn't going to be smiling upon you, then you have to do what you have to do, which is you got to start going after it. And going after it means spending the money, understanding what the investor global landscape looks like, and then, you know, not falling into the myths that everybody tells you. Like, you know, I was in this thing yesterday and someone said, you can't get invested in. I mean, what a thing to say to somebody. Anybody can get invested in. It's just might not be the right timing. You might have to do some work, but just saying you're not investable, can't say these things. So a lot of people say things like, you know, your funding choices are SBIR grants, friends and family, and, you know, that's it. And there's really 10 categories of investors, which we just, you know, in the past it might have been, you know, this particular scenario, but now there's large pharma that got corporate ventures, there's large pharma that have small groups in it that are looking for early stage technology, there's private equity and hedge funds in Europe and in the United States. If a hedge fund in New York City has somebody in it that's got a disease and they have a side pocket of 10 million bucks because they want to go after that disease, that's good money, and they know how to spend money. And if you can get in front of a hedge fund that has a reason to give you cash, you get it. It can shorten the cycle there. So venture philanthropy, we've talked about that. Patient groups, we've talked about that. So really understanding what do all of the investors look like and what are your choices globally so that you can really figure out who to go after. We just talked about limiting yourself to regional players. Statistically, it just doesn't make sense. The average fundraising process takes 6 to 9 months. We've just gone through that. I wish it did. It's not necessary to understand how each category of investor works. Just go after them all. So that's like the big problem that you run into. And I know all of the incubators in Massachusetts, and I'm real friendly with some of them. And one of my buddies brought me in. He goes, "Here's an Excel spreadsheet of 120 investors that everybody in my incubator goes after." So he's got an incubator with 60 companies in it, X amount of therapeutics, X amount of diagnostic, X amount of devices, X amount of healthcare IT, and they've got this one Excel spreadsheet with a company name, a company email, and a phone number, and some poor guy's name on it. And 60 people for 5 years have been using this list and just spamming these 120 people. So if you do that, it's just so wrong because you have to understand and make the effort of who the hell you're going after and know why. And the best reason for why is they've self-declared somewhere that they're interested in your stage of development and your product set. So yes, people go, there's this other concept which is they just want to prescribe what they want. I'll take like a family office, an Asian pharma, and a couple of European PE companies. Like you can actually prescribe the dynamic of who's going to invest in you. It's just like not possible. And people come to me, I'm looking for a family office today, and it's like, oh, okay. Well, there's a bunch of family offices over there. Have at it. It's just not going to happen. But what will happen is if you get a list of investors that are a fit for your stage of development and your product set, and we typically will do a search and come up with anywhere from 300 to 500. And then what we say is, go reach out and canvass these guys. So you put a brief email together. You say, here's this product that we have. We can take a drop of baby's blood and we can do this. Click here to see the video. Click here to see the white paper. Click here to read the executive summary. Click here to look at the management team. You've got 3 or 4 things to click. And you go out and you just canvass those guys. And if in the title you say, LSM partner bought the database and, we found you and we want to know if you're interested, something, benign, that's true. And then you have yourself connected via constant contact or the email engine that's going to say, hey, of those 500 people, 200 people clicked. And of those 200 people clicked, 20 clicked 4 times and 10 clicked 3 times and the rest of them clicked twice. And so now you have 50 people that clicked on your stuff, read your stuff, and now they've kind of declared to you through the reporting mechanism that they've shown an interest. So now you go and phone canvass those guys or ping them back with an email or do a little bit of research and you start this thing which we call a dialogue. So getting somebody that's interested in you takes the chances of you having a successful canvas when you reach out to them is like 1,000% of the equation. If you go after people, you're a device guy and you're going after someone looking for, therapeutics for orphan diseases, what the heck are you doing? You're wasting people's time. So it's super important to be able to find the investors that are a fit for you globally, and you can actually do it. We have a database that that does it, and it's pretty effective. And then when you have a list of people that are a fit for you, and you reach out and touch them, it's amazing. It goes from like 5% to like 20 to 30% hit rate. Hit rate means they clicked or they downloaded something. So it's just a really, really high return on clicks when you go after people that are a fit. And so, this shouldn't sound crazy, right? Like go after somebody that you have something in common with instead of going after someone you have nothing in common with and would never talk to you. But unfortunately, because we're in this place where scientists are going into the world of sales, it's a whole new ball game, and they just miss some of the basic concepts of, you're in the sales game, guy, and here's how it works. So understanding each category investor, there's a whole bunch of them, and I say if you get one investor that's interested in you, that'll spawn a bunch of other investors, and then you can get a syndicate, which we'll talk about in a little bit. So the other problem that happens is you're a scientist and you think the only thing that matters is the technology, and so you go and you talk to someone and you're just spitting out technology and speeds and feeds and why the molecule's different and why the crystals are different, and you're doing all this stuff, and it's not going to help you, because if a family office wants to come to you and they have somebody that's in their family that has a history of breast cancer, and you're talking about how you can do something with the cells in the tumor, and they just don't understand anything that you're talking about except for the fact they want to help their family. So you have to get your message and you have to get your story straight. And I was just in Portland, Oregon last week, I think, and we had some pretty heavy hitters on this panel I was at, and big billion-dollar marketers, and they're saying this story like you got to have a personal story that's got to be authentic, and then that authentic story leads to commonality, and it's easy to start a dialogue based on a relationship that you've discovered through the story. So being able to tell your story straight and not just get lost in the technology. I had these guys come in. One was a Nobel laureate, and they were like 70 years old, and they'd been together for like 50 years. So they come in, like shut the door, open the door. They're arguing with each other. They bring a PowerPoint that's 120 pages. And I'm going like, are you guys for real? Like, what if I was an investor? You're arguing with each other. You've got this 120-page PowerPoint. It's like, it's not your world. You're coming into the investor world. You got to get it down. So after several weeks with them, we had them able to, in a couple of sentences, explain this really complex technology at a high level. And the goal was not only they could explain it, but everybody in their office could, including their admin, what the heck they do to fight malignant breast tumors. And at the end of the time when we built their website, they basically said, thank you. We really learned something. We're coming in and we're so difficult and hard to understand, and you just made it simple that we could start a conversation and have a story to tell, and their story was fabulous. I mean, the guy's a famous Nobel scientist, and he said, he used to watch birds fly, and said, why does a bird fly? And it's just the question he asked himself when he was like 6 years old turns into this gigantic journey where he winds up figuring out how to, try and figure out how to cure breast cancer. So, getting the story down and not just worrying about the technology is super important, and getting the story down crisply and quickly. This is the one that drives me the craziest. You need to be referred to another investor from another investor, which couldn't be further from the truth. So, people who are in incubators and other places, they haven't been doing stuff for a while, they'll make this statement, you can't go call on that investor unless you know somebody that knows him. So the investor says to us, I'm looking for small molecules for oncology, preclinical, heading towards IND, that's what I'm interested in, please find them for me. The guy's going, you can never go and talk to that guy unless you know somebody that knows him. So there's these myths out there that make no sense. Of course, if you get a referral from somebody, there's nothing better than a referral. My friend told me to introduce myself to you. I call this the last 3 feet, by the way, when you reach out and shake somebody's hand. And you throw out the last 3 feet and you say, hey, nice to meet you. Let me tell you about my product. We figured out how to do this technology. So that helps a lot. But if he's looking for you and he's going to people like me and saying, here's my mandate and here's what I want to invest in, you can say to him, I'm an LSN partner, I read your mandate, I'm a fit for what you're looking for, here's some information. There's a 40 or 50% chance that guy's going to get back to you. So one of the things is do not fall for the things, the myths and legends that people say about investing. Because if you do, you're just going to get yourself into a corner build this wall around yourself and create a universe that does not exist. And that's like pretty much what we've seen when I came into this particular industry 5 years ago, which is why I wrote, this book, because, obviously I'm a sales guy. And so when a scientist looks at me and says, I am not that sales guy, I will never be that sales guy, that's fine. But I said if I wrote it down and they just read it, just read my words to help them understand the scientific thinking that doesn't work in the sales world, if they can just read this. So I write this book, and every single time I go anywhere, there's some PhD that comes up to me, I read your book, it really helped me because it gave me the straight story of what I really need to do, which is, simply sales 101. So you don't need to get an investor referral. You need to find an investor that's a fit for you, and you need to say, hey, I fit your investor mandate, we need to talk, and I guarantee you the guy will talk to you. Send as much information you have. So you just throw everything over the transom, and you're just hoping that the guy will find all this junk that you gave him, and he'll go, oh, I need to invest in this guy. Oh, I need to meet this guy. Very, very dangerous thing to do. So we spend a lot of time on this concept called branding and messaging, and your brand is really you, and your brand can be you if you're just one person. It's just you. And so understanding who you are and how you want to project yourself to that investor, and everything's virtual anyways in the world we live in life science, but understanding they do not want to see a 120-page PowerPoint. It will be the kiss of death. What you have to think about is, what is the, my logo? So, your logo can't be like, a hammock between two palm trees. It can't be a Viking ship. It's got to be, something that's somewhat, relevant to what you're doing. And then there's your tagline, and your tagline is 6 to 7 words that describe what you do, and it can't be cleaner, faster, brighter, blah, blah, blah. It can't sound like a, toothpaste or laundry detergent. It's got to actually say what the heck you do. So everybody say, making cancer safer, the crazy things, these gigantic universal things that people say about themselves, when really they need to say exactly what they do in 5 words, like we're, rehydrating malignant cancer cells and curing breast cancer. And it's like somebody that understands what's going on with dead cells and the controversies that's going on with, like, how do you deal with them? Like, what, re-engineer them, redo them, revitalize them, what do you do? When you have that tagline of 5 or 6 words, holy smokes, that guy's going, I know what he's doing, I want to talk to him. So understanding your tagline and getting it straight, and we can help people do that. We were helping people do it yesterday. So then the next thing is, what's your elevator pitch? And your elevator pitch is 6 or 7 sentences that briefly describe what you do, but it's really, what the heck is your value? And you've got, the elevator pitch, you've got 30 seconds to tell somebody, what the heck is my value, and what have I done, and how am I going to do this? So you have to really work on your elevator pitch, and all these things change the more you meet people and they talk to you and they ask you questions, and you get the feedback and you go, oh wow, this is what I keep on hearing, so I better go fill this hole when I first meet somebody and tell them about what the heck I'm trying to do. So the investor feedback you get is super important. So that brings up yet another topic of, is it too early, are you ever too early to go meet an investor? And the investors that I know of, and there's 300 there and there's 5,000 in my database, every single one of them emphatically states you are never too early. You just are never too early. You can't go sit with them for 5 hours and bore the heck out of them with something that you don't have prototyped yet, or you don't have any data on. But you can go out, shake hands with them, say, just want to introduce myself. I know you're investing in my space. I want to get in your orbit. I don't want to take a lot of your time, but I'd like to tell you what I'm doing so that when I see you at the next Resi conference, I'm able to give you an update. And the update's only going to take 5 seconds. And then you see him at the next Resi conference, you see him in New York in November, and then JPM in January. Now you say, hey, I just got some mouse data, and you guys going great, so tell me how it goes. When you get to IND, let me know what's happening. And so now every time you see this guy, he says hello to you, and every time you're giving him more information, it's taking 30 seconds. It's not taking any time. But then all of a sudden, you're ready to go to phase 1 or phase 2, and you need 10, 50 million bucks, and he's been following you for a long time. So you have that really great situation where you're not starting from scratch. You've been talking to this guy for 6 months. And so that's what really, counts. That's really hard to explain to people. They're going, I don't want to talk to anybody if I don't know what I'm doing yet. I don't want to talk to anybody if I don't have the data. And it's like, it's not talking to them, it's getting on their radar screen and being able to have a little dialogue so that the guy knows, the person knows who you are. We won't go into the, I'm a scientist, I'm a rock star, nobody has anything like I have. And so I have a database of 46,000 assets globally, and I can't tell you the amount of time I go to, somebody in George Church's lab or Bob Lang's lab, they come out. Nobody's doing this. It's for autistic children. It's a special ball that nobody's ever seen before. It rings, it chimes, and then you go, really, let's just go see. And then it's like, well, what are all these people? So there's always, the big controversy is, when somebody gets a unique idea, is it a lightning strike, or is it a mushroom spore with 1 million spores and the same idea came up all over the planet? I have not seen any lightning strikes in my life, and I'm 64, edit that. But I see a lot of mushroom spores where an idea comes and falls all over the planet, and then people get this idea and they start to work it. And it might come into 100 people's minds, and then it might be 20, and it might be 10 guys or 7 guys that are looking for it, folks that are looking for it. But there's never anything that no one's thinking of and it's unique. It just doesn't happen. And so you have to be aware of where the heck is your competition, and where are you in relationship to your competition. And understanding that is super important, because when you go to an investor, you go, there's no competition, I'm the only guy who came to me in a dream, and it just doesn't work, because people who've been around technology know that. The other thing that happens is science is the hard part, and the business is the easy part. And they're both equally difficult, let's agree to that. But it's super important that if you're going in front of an investor and you're asking him for money, and you've got you and your lab partner and some other people that are going to be involved in raising money, and a guy says, so does anybody ever manage money before? Has anybody ever written a business plan? Has anybody ever procured a product? Has anybody ever done anything? And the answer is no, but we can learn. The answer is no, you can't. I'm going to put somebody in there. So when you're getting in front of investors, you want to make sure that you're aware that, yes, there's the science, but there's also the business partner. And who's that business partner, and does he have any experience? So if you don't bring a business guy with you, they're going to put one in there. And so you want to make sure that your investors are deeply involved in your company, but you don't want to have your entire staff be put in by your investors, because that doesn't usually spell very good things for you, the founder, in the long run. So, we reach these kind of ideas where we say, if you're going to be can a scientist be a CEO? Yes, they can. I was out at a university recently, and the head of technology transfer said, I do not allow scientists to have C-level positions in companies they invent. And I just looked at the guy, and I'm like, really? So, geez, I wonder what Bill Gates would say about that. I wonder what all of the famous scientists who invented billion-dollar Fortune 100 companies would say. So I think a scientist can be the CEO, but he has to decide he's going to be the CEO, and he's not the scientist. And if he's going to be the CEO, he's got to learn all the business and do all the things he needs to do. But he can be the CEO, he just has to learn it, and there's no big fight about it. But barring them from it, no. However, yes?
Yeah, but there's another issue with that. There's also conflict of interest for universities.
Yeah, well, in the tech, yeah. So there is legal issues, depending on the tech transfer group. But, tech transfer is it's another thing. All technology comes out of academia, and all all technology's got to go through the tech transfer guys. And some are antiquated, they're living in the 1950s or 40s or 30s or 20s. And others are bleeding edge and they're going, we just want to make it easy for you to get the technology out. We want a little piece of the profit and a little bit of the tail, and we want to make it easy for you. And so, you know, understanding like how to do the tech transfer stuff is also important. So we'll talk a little bit more about, you know, what it's like reaching out, you know, to the different groups of investors. But you know, the angel groups, and each one of these has their own personality. You really got to understand them. You know, if you're dealing with angels, they're kind of stodgy and grumpy because they've been dealing with like hundreds and hundreds and hundreds of startup guys, and they're not as patient and as kind as they should be after dealing with, you know, crazy scientists who want to start these crazy companies. But you know, if you get a really smart one, they can really help guide you and navigate you. The corporate VCs are cool, but you know, you got to realize what their mandates are. So you know, here's the different people you go after. This is the one that everybody thinks you go after, and that's the one you should really stay away from, unless you know for a fact that they do early stage investment and they understand the issues, because a VC's job is to get money in and get money out as quickly as possible. And so when you're starting an early stage company, money's coming in and exits aren't coming out that quickly. It takes a long time to get that to fruition. So we have some, you know, an infrastructure where you do the assessment of your company, you get the marketing collateral, the things we told you, logo, tagline, elevator pitch, you get your global list of investors. Here's another thing that's like, you know, super important. I've got two like really important things. The first one is if you're going from technology into business and you're raising money, you've gone into sales. Sales is all about a list of qualified prospects. So you have to do this thing called list management, whether you like it or not. And so list management, if you're a scientist, means multicolored Excel spreadsheets, which is insane. Or you can go get like a Salesforce.com or any of these other, you know, CRM type products that if you get 500 potential investors that are a fit for you and you move it into an Excel and you import it into your Salesforce.com, now you have this system where you can actually deeply manage a list of 500 people really quite easily, where it's practically impossible to do it with an Excel multicolored spreadsheet. And the things that you need to know in setting up a profile for yourself about why an investor is a good fit for you, and then as that 500 turns to 250 and the 250 turns into 125, and as it goes down, you have these profiles that are kept up to date by yourself or by a person who's going to be working for you. So if I was going to give advice to a fundraising CEO, I would say, you got to get your marketing collateral down. You got to get your global target list of investors. You've got to get your Salesforce.com up and running. And then when you start to do your canvassing, you need to find somebody that's going to make those 40 or 50 calls a day. And so in the college world, it's just like go hire a business person that's got an MBA that wants to get into a startup, pay them 20 bucks an hour and have them make the phone calls. But if you're the CEO and you're going to, you know, go out and raise money, you're going to get a list, you're going to go to the Resi conference, and you're not going to do the follow-up, there's this gigantic hole in the world, and it's called follow-up. And if you have a meeting with someone and you don't follow up on that meeting, and it's really hard to do, it can take 10 phone calls, 15 phone calls, and everybody said, I called him once, I'm not calling him back. I've called him twice, he's not kidding me. I've called him 3 times, I refuse to call the guy back. You haven't even got off the bench and got into the on-deck circle. We have to call people 20, 25 times to get their attention. And a lot of times when we call them, they apologize and say, I'm so busy, I really want to call you back, I want to meet. And it's the 20th phone call. And we've been trying to call the guy for like 4 weeks. So, you know, this is an issue. So if I was a fundraising CEO, and I've told people this, either find an admin that loves setting up meetings and can make 50 phone calls and 49 people say no, doesn't care, and that one person that says yes, she's a happy, or he's a happy guy that got the meeting. Or find somebody that's a young person that can make phone calls, like Sean can make 40 or 50 phone calls a day, and it doesn't bother him. If I had to make 40 or 50 phone calls a day, I would just shoot myself. I'd put a gun down or the phone, I'd kill myself. I don't want to make the phone calls. I'm too old and I don't want to do it anymore. But he can do it all day long. So I had this person, he was a famous CEO, IPO, did a bunch of great things in the life science space. And he came upon some technology. He goes, I got some technology. I'm going to buy your database. I'm going to get the list. I'm going to make the phone calls myself. And I said, you will never, he was a little bit younger than me, maybe. And I'm going, you're never going to make those phone calls. He goes, I will too. I said, no, you won't. You will never make those phone calls. You should just hire somebody to make the phone calls. You get the meeting, and then you can handle the meeting. You're the greatest guy in the world in the meeting, but you just can't make the phone calls. And so he got mad at me, and we had a little tiff, and then he left, and then 4 months later, I see him in Houston at my Resi conference. We're on the bus. He goes, I owe you an apology. And I'm like, okay, what did I do? And he goes, I thought that I could make the phone calls, and you told me I couldn't. You were right. And I hired this old admin of mine whose kids just went to daycare, and she now had 20 hours a week to make the phone calls. And she's getting me all the meetings and doing all the follow-up, and I'm doing really well. So, you know, it's just that little thing. You know, the $20 an hour for somebody for a week, $20 an hour for 20 hours a week, that's going to get you all the meetings with the list. But if you do everything right, if you assess your company and you figure out how we get the management team right, and you get the branding and messaging right, and you get the global target list, and you set up everything, and it's all ready to go, and then you don't follow up on the phone calls, and the phone calls and the canvassing are the most tedious things in the world. It's the most boring, tedious job you can ever find. But some people are really good at it, and they like it, which is, you know, some people like to do lab experiments on mice. They like it. It's okay. But the ones who like to do this are great in trying to force yourself when you're genetically incapable of making 50 phone calls a day. It's just a real push, and I don't think you need to do that. So, you know, the other things, logistics and scheduling, going to meetings and understanding that, but, you know, follow up, follow up, follow up. So we've talked a little bit about, you know, where we're at here, but you got to have your logo, you got to have your tagline, you got to have your elevator pitch, you got to have your executive summary. Your slide deck can't be 50 pages, it's got to be 10 to 12 slides. So what we did with the crazy scientists that came in with the 120 PowerPoints is we said, we're going to net this thing out into 10 or 12, and then in the website, we're going to have scientific discovery and, you know, different categories where we could put in all those presentations, but we weren't just going to force feed it to somebody out of a cannon. We're going to allow them to go to a website and just peruse through and pick out the stuff that they wanted to pick out. It's just really important to look at stuff that way. You know, we're just talking about, you know, your logo, and, you know, this guy right here, when sepsis happens, he figured out all of the chemicals that are put in when the immune system goes, you know, let's press the pedal to the metal and all the chemicals go. He weighed every single one of them. He figured out where everyone was, and he figured out a way to screen out all of the chemicals that happen during sepsis, and then kind of reboot the immune system. And if you're in the hospital and you get sepsis, you're pretty well in serious trouble. And so, you know, we had this idea that, you know, he would, you know, he has this thing that catches the blood. These guys were doing some things with, you know, starving bacteria that are immune to antibiotics. So, you know, just kind of, you know, having something that makes a little bit of sense and isn't, you know, the Viking ship going through the sunset. So, you know, we have examples of therapeutics, you know, first-in-class serotonin receptor modulators for treating Fragile X. You know, if you're into autism, and you know that serotonin is an issue, and these guys are figured out a way to modulate serotonin receptors in the brain. If you're someone that's really interested in this tagline kind of tells you who they are and what they're doing, and that's kind of what we like to see. Precision diagnostics and treatment of tremor and dementia disorders. You know, these guys have this radioactive agent that measures dopamine for people who have tremors. And so, you know, they're just a few words. They're bringing you from way out here in nowhere land to these guys are using dopamine for Fragile X. As we said before, treatments for septives and other destructive inflammatory diseases. Somebody meets you, they have your business card, they take your business card and they look at what your tagline is, and just that business card should be able to tell that investor or tell that person enough about you to see whether they are interested immediately. And so, you know, clean, better, safer cancer diagnostics is not going to do that. But something that's like really in 5 or 6 words says exactly what your value is. And if they don't understand it, fine, because they're not a fit. And if they do understand it, great. Anybody can ask questions here or comments. Oh, do you have any comments? Joyce, comments? You've been through it. Tell us what's going on,
Dennis,
Joyce.
listening to you makes me worried about everything.
Oh. So you came here and I made you feel terrible.
No,
Okay.
it makes me feel very focused. Anytime I spend with you, it's always.
Are you,
No, you're doing a good job.
what do you do?
Cancer treatment device for a compact proton therapy device.
So there's a nice little tagline and elevator pitch. Congratulations. That made sense. And are you raising money?
Yes.
Okay. Well, you got your tagline down. Who else is raising money?
You know, I think it's
Sick and tired. What are you
good.
doing?
What did I say?
Please locate you with the low jack.
I forgot it
You
already.
want what is it?
The low jack of people who wander. It's a little gimmicky, but you monitor patients who have wandering. So monitoring is huge. And how do you do it?
We have a device that fits on the wrist and the system works.
Okay, so that's cool. I know what you do. I get it. What do you do?
It's a third generation DNA sequencing.
DNA sequencing.
Yeah, there's very $100 in 1 hour in real-time sequencing.
So you are taking DNA sequencing and making it faster, cheaper.
Yeah, but that's cheap.
How much? How fast?
1 hour, $100.
Right. So I would say, I would say that, you know, like we're doing mapping a genome in an hour for $100. I mean, you know, that gets everybody's attention because that's what's happening today. Who do you work for?
Just start. Oh, before that?
You know, who do you work for now?
Yeah, we have just started
At.
at South Boston.
Okay, cool. Are you?
I'm working for a company called Looking Medicine, and this is a company looking for novel oncology targets against which we are developing antibody next level.
It's fabulous. So I got exactly what you said, and it wasn't that many words, and I'm sure if I wanted to get a lot deeper, it goes very deep, right? Great, okay. Any other questions or comments? Who's raising money? Okay, so what are you doing?
We do ex vivo organ support for transplant.
Oh, that's interesting.
Organs alive inside the body.
Yeah. So, I mean, you guys are all pretty sophisticated because you can say in a small amount of words exactly what you do. And I wasn't down on your low jack thing. I just think if you move it up to monitoring, it kind of gets it out of that realm of low jack. Like, I didn't have any feelings about low jack, but anybody, who else, what are you guys doing?
Well, I'm representing one of the Chinese companies to look
Yeah.
for investment and partner opportunity in the genomic analysis service.
And what kind of genomics analysis or what kind of stuff?
It's mainly for like whole genomic sequencing analysis service for particular neuro disorders.
can you do it in an hour for $100?
No, we cannot. We're looking for people who can do that.
Could I introduce you guys? And what do you do?
I work for Water Corporation.
Oh, okay, yeah.
We're getting more involved in venture funding and capital investment.
Okay. Well, I really want to talk to you.
Oh, good.
Yeah, because we were really happy to see you guys come.
Ah,
It's a big deal for us when a company that we know in Massachusetts shows up. And what about you, my friend?
With advanced gastro technologies, we have a device that essentially induces early satiety to gastric emptying delay by endoscopy.
Huh, okay. And you? Oh, okay, so I didn't get that one though. So what were you doing?
So we have a device, it's a medical device that keeps the organ alive outside the body.
Yeah.
We'll go to the donor, get the organ on the device,
Yeah.
assess it, and then move it to transplant. So the current standard of care is the next.
Yeah, who were the guys, so, who else some guys who did that before? They were called in vivo. They were out of NASA, they're space engineers from down south. Yeah, a lot of
That
them.
was from Massachusetts, was Canada.
Okay. So, great. So where are we for wrap-up? We got, what, 2 minutes?
Pretty much.
We done?
Out of time, yeah.
Oh, we're out of time. There's a bunch of books here. If anybody needs one, take one. And if you can't get one here, go to my table in the exhibit hall and you can get a book. So this is a good book if you're raising money. Sure. I think we're done. Thank you.